Hi, I'm Melissa, and I'm going to do a physical assessment on Kendall. Hi, Kendall. Hello. As I walk in the room, of course, I'm going to do my hand hygiene, and I'm going to provide privacy for my patients by closing the door or the curtain. Also, as I speak with Kendall, I am going to observe her appearance and look for any obvious deformities. I notice that Kendall is of stated age, and she is dressed for the season, which is appropriately, and she is clean and well groomed. I also notice that she has no obvious deformities, and her hygiene is very well taken care of. Her skin color is that of her ethnicity, and her posture, she is sitting erect and not slumping. I notice also that Kendall does not have flat effects. She is pleasant, she smiles, and she appears to be in a good mood. Also, I noticed when Kendall responded to me that her speech was clear and spontaneous, and also she heard me because she responded. Kendall, what is your nutritional status? How's your appetite?
It's really good.
Okay, so she has a good nutritional status. And I also noticed that when I speak to Kendall, she makes good eye contact. And I also noticed that she is alert and oriented ×4. Okay, now I'm going to inspect her scalp, looking for any deformities or any protrusions, any indentions, anything that should not be there. And also her cranium. And also at the same time, I'm noticing that her hair is healthy and well kept. It is clean. Her face is also symmetrical. And I'm going to palpate the temporal artery. Is that tender, Kendall?
No.
Okay, so it's not tender and it is not pulsating. And then I'm going to the temporal mandibular. And can you open your mouth and close it. And notice there's a slight pop when she opens, but nothing really that abnormal. The next we're going to do is inspect her eyes. I'm going to look at the eyes and see that they are symmetrical. There is no scaling or any drainage from the eyes. And I noticed that the conjunctiva is pink as it should be. Her eyes are moist. And the sclera is white, like it should be. I also see that her irises are both the same color and they're of normal size. And her pupil size appears to be about 3 to 4 centimeters. Now we're going to test the confrontation, which checks peripheral vision. Could you please cover one of your eyes with this? Okay, then I'm going to cover the opposite eye and face Kendall. And I'm going to move my fingers in. Tell me when you see them.
Now.
Okay. Again.
Now. Now. Now.
Okay, and then we'll do the other eye. And again.
Now. 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 Now.
Okay. And her peripheral vision appears to be intact. Next we're going to check the 6 cardinal positions. So, Kendall, as I move my finger, can you please follow it with your eyes, but do not move your head. Okay, and this shows that the cranial nerves 3, 4, and 6 are intact. The next I'm going to look at her corneas and notice that they are smooth, there's nothing on them there, and they are moist. Then we're going to see if check for accommodation and corneal light reflex. So I'm going to shine the light first in your left eye. I'm going to shine in there twice, and that is to see if both pupils constrict, which they did, and then the other eye. Okay. And now I'm going to hold my finger up here, look at my nose, and I'm going to move it towards your face. And I see that her eyes are accommodating. Both pupils constrict as they should. Okay, and then we're going to have you cover that eye And then I noticed that in this eye, it has a steady gaze. Can you cover the other eye, please? And again, she has a steady gaze, which means that her muscles are intact and strong, no muscle weakness. Okay, and then if we had a Snellen chart, we would show you how to do that. But what we would do is we would place Kendall 20 feet away from the Snellen chart at eye level in a well-lit area, and we'd have her cover one eye and read from the largest to the smallest that she possibly could, and then cover the other eye and repeat that, and that would tell us what her vision was. Okay, now, Kendall, we are going to move on to your ears. You notice that Kendall's ears are symmetrical. They have the correct placement on her head. You can tug on your ears a little bit and tell me if there's any tenderness.
No.
Okay. That would mean that there could be some infection in there that we need to look further into. Next, I'm going to use my otoscope, and I'm going to look into Kendall's ears. I'm going to check out the canal and the tympanic membrane. I'm going to pull up and back on the canal and insert the otoscope just far enough to see. And I see that the canal is clear and the tympanic membrane is pearly white. And I'm going to repeat on this side, using the hand on the side of the face to steady the otoscope. And again, the canal is clear and the tympanic membrane is pearly white. Now I'm going to perform the voice or whisper test. Kendall, can you cover one of this ear, please?
Sure.
And I'm going to say a couple syllable word and have her repeat it.
Lollipop.
And the other?
Car wash.
Okay, thank you. Next, I'm going to inspect Kendall's nose. I notice that it is symmetrical in the face, and it's not to one side or the other. It's not deviated any. And then I'm going to take a look up inside to check for lesions, make sure the mucosa is pink and moist, and there are no lesions, and that the turbinates are the appropriate size and that they are also the same color, and that the septum is not deviated. Now I'm going to inspect the mouth and the throat. First, I'm going to look at the buccal mucosa. Can you open your mouth, please?
Sure.
And I see that it is pink and moist. There are no lesions, and everything looks good. Also, at the same time, I look at the teeth and notice they're intact, they're white, and there's no discoloration and no cavities. Good job. Then I also am going to look at the gums. I notice that they are not receding or bleeding or swollen. And I need to look at your tongue. Okay, and the tongue is also pink, it has a little white on it, which is normal. And now the floor of the mouth. And I'm going to inspect it to make sure it's also the right color, and then I'm going to inspect it to make sure they're inside the mouth, to make sure there are no nodules or anything that's not supposed to be there. And could you raise your tongue?
Mm-hmm.
Okay. It is the right color, and there are some veins which are typical. I'm going to put on my gloves, and then I will make sure that we have no nodules or any deformities. Okay, and everything seems to be just fine. Now I'm going to inspect the palate, the uvula, the tonsils. Can you open up for me? Okay, the palate is white and it has some ridging, which is normal. And the uvula, say ah. The uvula is midline and it moves up and down as she says ah, which means her gag reflex is in place, which is also cranial nerves 9 and 10. And then her tonsils are absent. And can you stick your tongue out for me? Okay, and also cranial nerve 12 is intact. Now I'm going to inspect her neck. I look for symmetry, noticing that her neck is straight, it's not crooked, and I'm going to palpate for masses. I feel no masses or pulsations. The jugular vein is not distended. Next, I'm going to palpate the lymph nodes. First, I'm going to start with the preauricular and the postauricular. And then I'm going to do the tonsillar and the submandibular and the submental, the anterior cervical and the posterior cervical, and then the supraclavicular and the infraclavicular, the occipital, which is back here in the back of the head, and then I'm going to do the deep cervical, which is in your head that way, and these you can't typically feel, and then over here. And all the lymph nodes appear to be pea-sized, and they're mobile, and they are not soft or tender, not tender. Okay, and I'm also going to palpate the carotid pulse. She has a good pulse, and we want to make sure that the trachea is midline, and it is where it's supposed to be. And now I'm going to ask you to turn that way, and I'm going to position myself behind Kendall. And I'm going to palpate her thyroid. I'm going to ask her to swallow. And I feel it move up and down as it should when she swallows. I don't feel any growth or anything in there that should not be there. Now, Kendall, can you turn your head and touch your chin on your neck, the other side, and to your chest. Her range of motion is appropriate. Now I'm going to test her muscle strength. Can you push up with your shoulders? Okay, and push that way against my hand, and not this way. And her muscle strength is appropriate for her age and her physical abilities. Thank you very much.